just would love to know who you are, what you do, if you've ever used IM, if this is your first time experiencing it, and what the population is that you work with. So Dana Carroll, you are the first contestant this morning.
Thanks. Good morning, everybody. My name is Dana Carroll. I'm in Virginia. I have a small private practice called Play to Grow, and I specialize in early intervention. I did IM probably 20 years ago. One of my OTs wanted to be certified, and so I was one of the guinea pigs that went through her training. So it's really interesting. At the beginning, my pre-test was like tilt, like zero, no coordination, terrible. I have two athlete children, and so I'm kind of looking at my pediatric population, but also the athlete component, and doing something with my children's team and kind of seeing where that goes.
We work in an optometry office that specializes in different types of vision therapy. And so I'm a certified vision therapist. I've been doing it for well over 20 years. Martha has graduated with a degree in bioengineering, and started realizing the work that we do and is really useful. In our office, we see some peds. I've worked with a lot of a pediatric population in other offices, but we primarily work with stroke and post-concussion and a lot of neurological cases at the moment.
And is this going to be an accessory to what you already do? Have you been using IM, or is this just something that you had heard about? What brought you to the course today?
So the owner of the practice, the optometrist, and one of the resident occupational therapists have been trained in IM. And so they were like, I think that if you guys learned a little bit more, because we're more in the therapy aspect, that we'd be able to implement it with the patients. So
okay, what do you hope to achieve with that?
One of the hallmarks of our treatment center is that we focus on sensory integration. So we definitely integrate vestibular, visual, auditory, proprioceptive stimulation. And I think that we do have some tools that we utilize more than others, and we want to make sure that we understand and use all of the tools that we have at our disposal.
So people who get a lot better, and they're like, hey, is there anything more we can do? We keep asking, like, hey, let's see if we can get you from when you were kind of wheelchair bound, and now let's get you doing more stuff. Yeah. And so that's kind of what we're hoping for.
That's amazing.
I'm Abby. I am a pediatric speech therapist in Pennsylvania. Our OTs are mostly IM trained in our facility, and I'm the first one on the speech train to get going. I actually co-treat a lot with OT who uses the IM software. So it's been great to see how they're using it, and also get some ideas for how to incorporate some of my speech side into it too.
Exactly. Do you notice that the kids that are doing IM with occupational therapy do more or have more ability to change with speech, your speech goals as well, before you even know that IM was a thing?
Yeah, I definitely can see that, because we'll kind of start with an activity, we'll do like a little IM thing in the middle, and then kind of come back to it. And I feel like the response time is quicker. The processing speed, they're kind of recalling things a little bit more quickly. So just from a outsider's perspective, I'm definitely seeing the benefits of it before getting the actual training, which is great.
That's amazing. I'm so glad you're here, Abby. Good morning, Jennifer.
Hi, I'm Jennifer. I am from Arizona, and West Coast. And I used to be a teacher for many years in the school districts, and then I started learning more about dyslexia and became a dyslexia interventionist, certified in a couple different programs. And then I left the district to open up my own reading intervention tutoring business, where I work primarily with kids who have dyslexia or some language-based learning disability, but maybe not a lot of kids that are autistic. Kind of runs the gamut of all their their profiles. But I use the speech to print approach, so a linguistic based reading program. And it was just recommended that IM can really help some of those kids. I'm looking primarily for fluency. Just some kids, you can teach them all the phonics and you can do all the different interventions, phonemic awareness, and something with their fluency. The fluency is just the hardest thing to improve. And so I'm just trying to add another tool into my toolbox.
Good morning. So my name is Tiffany and I am an unseasoned OT. I graduated in April.
Oh,
so,
wow.
Yeah, I'm very new to the field, but I came and I work at the Teach Group in Knoxville, Tennessee, and we have speech behavior therapy and OT here. And so the OT that was previously trained in IM is becoming a consultant because she's retiring. So she asked me when I was hired, probably a couple weeks in, she was like, come observe some of my IM sessions, see what you think. And I just thought it was really neat. So we are trying to launch that here a little bit deeper. We have about 2 kiddos that are doing it right now, and we've seen some great improvements. So we're hoping to kind of expand our criteria. That way we are able to kind of justify the services to parents and target different kiddos with it.
I have a private practice, I'm an educational consultant that I look at the root cause of learning difficulties. So a lot of my training is European. So IMPP out of the UK, the Institute of Neurophysiological Psychology, Reflex Integration, and Tomatis. So I'm a Tomatis consultant. And I came to Interactive Metronome. I do a lot of trainings with Maud Leroux. She has a clinic that incorporates, she's a Tomatis trainer, and her center incorporates Interactive Metronome too. So that's how I learned about it.
So Gavin is a 10-year-old who presented with autism and anxiety. His parents noticed that he really had intense outbursts, behavioral outbursts when he was in a noisy, crowded, super multi-sensory environment. I'm sure you all have either clients or friends or children yourselves that you can relate to in this. I myself don't love large, busy, crowded areas for long periods of time. And when you throw a child into a school environment, especially in today's society, we're really hurting for space and teachers and, independent instruction. And so it becomes a perfect storm for poor Gavin, where he has intense behavioral outbursts. His family has 2 boys. There's a younger sibling, and parents would love to be able to stay at the holiday performance at the school so that they could watch both Gavin and his brother. But last year it didn't go so great, and he had to be removed from the environment. Family had to leave. So this year, Gavin started training using the IM Home and initially completed 8 sessions. He did not have other interventions. Now, the IM Home is an accessory tool that is licensed for home use, and it is overseen by you, the certified provider. So it is not intended to be used with multiple families or in a clinic setting. It was developed to give families who maybe had insurance challenges or had distance, had to drive a long way to access a provider. It was developed a long time ago, actually, to increase access to the Interactive Metronome technology. And it has been such a godsend for so many families, especially during COVID, when everything turned to telehealth, right? And so IM Home is a technology that works exactly as the IM Pro that we are going to be using today, except all of the maintenance of it, all of the training plans, and setup of training is done in the cloud. But be aware that this is a great tool to use for those clients that maybe are prohibited by financial or insurance access or distance. So Gavin did 8 sessions. He was able to actually participate in the concert, join his classmates on stage. He sang along with the peers and tapped out the beat on his leg. You know, he was actually really enjoying this experience. Functionally, this is where the rubber hits the road, right? Functionally, his therapist also observed that he is calmer. He's less stressed, able to make eye contact and take on other tasks that were previously too challenging for him or that he would quit. Parents also noticed that he had better social skills overall and had better self-regulation at home. So quite a big win for this young man who worked really hard. The rest of his case study can be found on the Interactive Metronome website and more details for it. Brian is our next case study. Brian is a preschooler born with TTN, or transient tachypnea of the newborn, which is something that causes respiratory distress, and it requires an incubator and oxygen at birth. So due to this, when Brian was starting to go through his development and age, he was extremely impulsive and highly distractible, had a really hard time at school, hard time with other kids, with personal space and boundaries and self-regulation, a really hard time following directions, needing a lot of repetition, and then behaviorally would express frustration with frequent outbursts, emotional meltdowns, and repetitive behaviors, hyper-focused on things. So he was very oral seeking. His parents did make the decision to medicate him because of his high anxiety and his inability to self-regulate. So one of the things that we highly recommend that you do as a practitioner, no matter what your field, would be to give pre-testing with standardized assessments or discipline-specific assessments that you would use to qualify a client for your services. So I know what you're thinking. You're thinking, well, what tests would I use, right? Well, that is not for me to determine. That is for you to determine as a practitioner. As an occupational therapist working with children, mostly, I give a lot of BOT, 2 tests, TVPS. I'll do the PDMS, the Peabody. So those are just some of the tests that I use as baseline to establish functional baselines, okay? Then once we start using the IM, I know that I can go back to a functional standardized assessment and I can say, wow, not only did we improve our IM scores, but look at what the standardized assessments scores are showing as well. They're also improving, okay? And so what you're seeing on the screen right now, if you're with me right now, you'll see that there were 3 assessments that were given to Brian prior to starting the Interactive Metronome: the test of auditory processing skills, the test of everyday attention in children, and the social emotional evaluation. Now, what you'll see are all of his baseline scores prior to doing the Interactive Metronome. The post scores are at a point where these tests could be re-administered. So following the guidelines of the test, some tests say, you know what, you can re-administer this test in 12 months or 6 months or as needed, right? And so following the guidelines of each of these tests, after Brian had been training, they re-administered all of these tests. And in red, you can see on the test of auditory processing skills, his phonological skills went from the 55th percentile to the 86th percentile. Memory from 50th percentile. This is auditory memory from the 50th percentile to the 63rd, and cohesion from 47th percentile to the 70th percentile. Now, Brian's scores initially, they were right in the middle. They were in the 50th percentile on this test anyway, but regardless, they all improved. Now we'll move to the test of everyday attention in children. Wow. Brian's pre-scores were below the 20th percentile on selective focused attention. And for sustained divided attention and sustained attention, his pre-scores were under 1%. Post-scores, post-training, sustained divided attention moved up to the 96th percentile, 96th. Selective focused attention went from the 12th percentile to the 56th percentile, and his sustained attention overall went from the below 1% to 30th percentile. Wow, you guys, that is huge. And then for the social emotional evaluation, for his receptive social emotional scores went from the 5th percentile to the 90th, and his expressive percentile was from the 10th to the 95th. Wow, wow, wow. So lots of changes here. Brian participated in 27 sessions of interactive metronome, and it was the only intervention he received. He did not have speech or PT or OT or educational tutoring, just IM training. His teachers reported big improvement in self-regulation, his attention, focus, his ability to complete his work with fewer reminders. Improvements were also noted in reading fluency, comprehension, handwriting, and overall writing in general, creative writing. Greater interest was developed in writing overall, with fewer periods of distraction and more legible handwriting. Now, I'll take you back to my first statement, which said he did not receive any other interventions, but his handwriting improved. His parents reported better relationships with peers in social groups, also better home environment, self-regulation with siblings, less verbal outbursts and meltdowns. And the parents also observed that when he was playing sports, he had better eye-hand coordination. So quite a win for this young man as well. Our next case study is Diana. And Diana is a 23-year-old college senior majoring in business administration. Now, we are in the Olympics, y'all, and I don't know if you have watched any of the synchronized swimming, but wow, what a challenge, right? And talk about having to be right on the beat, right? We're talking milliseconds, and Diana was able to do that, and she was able to participate with her team as an Olympic level synchronized swimmer. But unfortunately, she suffered a severe TBI and was unable to return to life as she knew it. So she had to cut back from all of her activities during her rehabilitation, and that included synchronized swimming in college. So the TBI affected multi areas of her brain, cognition, and overall sensory behavior. Memory was affected, receptive and expressive aphasia. So her language was affected. Her executive functioning was altered in that she was more impulsive and disinhibited, very socially inappropriate at times, and unable to problem solve or organize things. She was easily overwhelmed with lights and noise and visual stimuli. So I know that some of you work with post-concussion, post-head injury, and I know this is not new to you, but what a challenge for a young woman who is at the peak of her living her best life. But Diana was a hard worker. And she did 24 sessions of interactive metronome in her rehabilitation over a period of 2 months. And at that point, she continued training, but she was able to return to college part-time with the goal of transitioning to full-time. She was able to resume her social life, return to synchronized swimming and coaching, and return to driving independently, which, as you all know, is so important for a young lady. So this is a big win as well, and what an encouraging story. Our last case study this morning is John, who is a 47-year-old father of 4 teenagers and the primary source of family income. Unfortunately, John suffered a right hemispheric stroke and was unable to continue working, had to go into rehab, demonstrated impairments in self-care, his activities of daily living, mobility, balance, which is huge because fall risk after a stroke is greatly increased. He had significant tremors and spasticity in his left upper extremity, and his cognitive abilities were altered. So, as you know, any parent who has any child is very anxious to return to work, but with 4 teenagers, yeah, I would say that this was a priority. So John participated in interactive Metronome, and as well as other skilled services. He worked really hard and was able to regain independence with his self-care, activities of daily living, medication management, family budget. He also demonstrated significant improvement in the ability to take care of the home. His balance and coordination improved. Again, we have to be so careful, all of us, anyone who has a stroke or is aging, about that fall risk, because we know that falls are the #1 cause of hospitalization with people that have a history of strokes or acute injury. John was also able to work hard and pass a driver's evaluation and resume driving, and he was able to return to his normal routine and work. Okay, so that is our research portion, and there is ongoing research, and there's also more case studies for you to access. If you go to the website, as I mentioned, you'll be able to unlock that today as a provider. So we're gonna dive into the use of IM and how we might use it with clients. And so I want you to consider a few things as you are looking at setting up your IM equipment. Do you have a separate room that you could use to set up all of your equipment? I do have separate areas. I actually put everything on a cart so that it's mobile, so that if we have an office space that we can go in to train, that really helps, especially in the beginning phases of learning IM. If you want to get into the cloud to use some of the training programs, do you have Wi-Fi access? Do you have space where your client could sit down if they fatigue, or could take a sensory break? Sometimes people will hang a do not disturb sign. As you all learned today earlier, having fresh batteries if you're using the wireless triggers and working speakers is important as well. So a tip for y'all using the wireless triggers with the batteries would be not to leave the batteries in the triggers when you are using them, just because they're giving a signal to the IM as long as the IM is on, and even if it's not, you know from Bluetooth and Wi-Fi that there's always a little bit of energy out there, right? And so it's just, if you want to conserve your batteries, just pop them out at the end of the day, especially if you use the IM throughout the day with different clients. So the concept of interactive metronome. Now, a lot of people come to this course and they are really freaked out about the fact that there are auditory and visual guide sounds. Now, these guide sounds, I will play them for you. A buzzer. We call these guide sounds because they guide you as you are working with the IM. Let's just say you are the one that is the client. They guide you as the client to alter your motor plan, your reaction timing in real time. However, we will not throw a new client into a situation where they will have to differentiate between all of these guide sounds. But I want to introduce the guide sounds to you very quickly here. There's a buzzer, and that buzzer is either in the right ear or the left ear. If that buzzer is heard in the left ear, it means you're early on the beat or you're ahead of the beat. If you hear that buzzer in the right ear, it means you're late on the beat or behind the beat. Okay, and that's a significant alert for you. It means that you're really early or you're really, really late, right? And so that is the cue that you might want to even pause, listen to that reference tone and slow down or speed up. The next sound is a rubber band twang. And again, you will hear it in the left ear if you're early, the right ear if you're late. Okay, and this rubber band twang is to alert you in real time that you should alter your motor plan so that you can hear the next sound, which is the high pitch reward sound. Now, this high pitch reward sound is the sound that says, yes, you are right on track. You're right where you need to be. Stay there, right? Now, we measure everything in milliseconds using the interactive metronome. So 1 second has 1,000 milliseconds in it. And what we want is we want the lowest possible millisecond reaction timing. And so when you see numbers, as you see on the bottom of this slide, the numbers that you see are in milliseconds. A perfect score would be a 0 millisecond number on the screen. An average score for an adult would be between 40 and 100 milliseconds. And then beyond that would be a higher score. We like lower scores with interactive metronome. That's what we like, because that tells us that your brain is responding in a very quick millisecond time frame. And we know because of research that the quicker your response time, the better your executive processing and your cognitive functional abilities. And that affects all of your body, not just your behaviors, but it also affects your motor skills, right? Your handwriting, your ability to have hand-eye coordination, you to play pickleball if you're my age or Troy's age, to go on a hike, right? Or to drive a car. So we want those lower millisecond reaction times. So I want you to get it in your head right now that the numbers you see on the screen when we start to train are millisecond timing numbers. So every time you clap, or your client claps, but for you right now, you're the client. Every time you clap, you will get a number, and that is the interactive metronome measuring to a millisecond how close you were to the reference tone. I want you to think about, as you are working either independently or in a group, what is your timing? Are you always early? Are you driven by sensory processing? Are you anxious? I know when I first started doing this, I was getting a little bit anxious about this, all of the sounds, didn't really understand. And again, that perspective really helps me as I train my new clients. Are you way early or way slow? Are you clapping randomly? Are you clapping contraphasic to the beat? Do you hear the beat and then clap? Because sometimes we don't understand that this is like listening to music and tapping your toe. So some observations about timing for you to just keep in mind. So there are modifications that you can always make. There is no one size fits all to our interactive metronome training. You as the practitioner today are going to learn what that means. But if you have a client that you're working with, or you yourself need to skip certain activities or take a break or rest or put speakers on, those are all okay to do. The one thing that I will tell you not to do when you are performing an assessment or you're administering one of the assessments would be, don't cue your clients. Keep your mouth shut. Don't give them verbal cues. Don't give them physical cues, and don't give them visual cues. That would be like sitting down to take the SAT or the MCAT or something, and the teacher up or the moderator giving you flashcard cues. Okay, we don't get cues when we test, and that's the same thing that happens with the IM. However, for the assessments, you can absolutely modify. So here's a couple of examples of modification. This is Mr. Jackson, who we're going to be talking about again. And when he was working on the IM, he was really flat with his foot and he was just having a hard time with it. So what I did is I modified and I put the speakers on so that he can hear them. But I gave him button trigger for his foot. Now that's okay if you have a client that can self-regulate, but if they're going to smash it, you might not want to use it. They're kind of expensive to replace. So that's just one type of modification. When we start doing, or when you start doing the short form test, it will be as an initial assessment, as a warm up, or a quick 2-minute start to the training. But again, because it's an assessment, no looking at the screen. We want you standing and moving your hands in a circular motion. The reason for that is to bring your hands to midline, and it helps with your rhythm and timing. And you can then, after you have 2 or more points of data, then you can start to compare the tasks. The slide that's up right now, slide number 51, has a script for you for administering the short form test. So you're going to hear a metronome beat through the headphones. You're going to put the headphones on, right and left ear. That's kind of important. You will have a trigger strapped to the palm of your hand. You're going to put your thumb through the hole on your dominant hand if it's available, and then you're going to secure the Velcro either on the back or the front, and then make sure that the button trigger is right in the middle of your hand. After you have the headphones on and you have your button trigger on your hand, you will push the start button for them. What you're going to tell your client, what I'm telling you now as a client, as soon as you hear that cowbell sound, I want you to clap with the beat and keep clapping until you no longer hear that sound. After you are done with task number 1, a score box will come up and you will push OK, and you will automatically be ready to go to task number 2. There will be nothing you need to do on your software. You just have to push start again. Short form task number 2 will have those guide sounds. And the way I explain this to my clients is you're going to hear some other sounds, and they're going to be coming in your right ear and your left ear. But I really want you focused on that cowbell reference tone. Just clap to that and keep clapping until you no longer hear the beat. It's okay to stop and listen and start clapping again, but don't stop for more than a couple of beats because that can throw off your score. Now we are gonna go into, like I said, the long form assessment. Now the long form assessment is a much deeper dive into motor planning and awareness of body and space. So I'm gonna walk you through it, and then we'll go back and you will actually be doing the long form assessment as well. So here's a kind of an example of modifying. This this is my friend Connor. And Connor was born with a stroke affecting his right side. And Connor actually has full range of motion and similar strength on each side, but he has a mom that feels very guilty about being born with a stroke neuro. And so he's really ever been challenged, even though he's 11 years old. So clapping, he was okay with that. Once we got to...
You're doing awesome.
The foot tap.
Both toes.
And again,
You're doing great.
recording this and showing it to you just so that you can see a raw example.
Toes. Keep going.
Of what you might
No, on, off.
choose to do.
Okay.
So because of his performance on that task, we just said we're done. We're going to do just the upper extremity tasks. And I'm going to show you what all that means here in a minute. But I want you to be comfortable enough to understand that it's okay to skip some of the tasks or not do them. And then maybe in a few weeks after training, you feel like the client might be ready for them. The other thing is, as you guys are learning today as well, when you first start out doing something, you're going to have big movements, just like Jackson in this video, big movements, right? Well, as you are training and as you get more comfortable, I want you to look at how much more comfortable he is. And I don't die on the bridge of circling your hands into midline. We like to start there, but not all of your kids are going to be able to do that. Not all of your adults, especially if they have a stroke. And so you're going to have to modify, but as I mentioned, there will be changes in how each of the tasks is performed as your clients get more comfortable with the IM. So look at these side by side. You can kind of see where Jackson has really, his body is way more comfortable. He's moving not so rote. He's a real rule follower. He does have a diagnosis of autism. And so doing anything for the first time, he's a big rule follower. The third assessment option that we have is that attend over time test. If you choose to do the 10 over time test, it is a 9.3 minute assessment, just clapping, no guide sounds, standing up. And the scores will be reported at the bottom of the long form assessment report. And I know that you're wondering, like, what are all of the exercises and where do I find out how to do that? So first things first, go to your training box at the top right and choose long form assessment. And to the right of that, choose pre. This means pre-training on the interactive metronome. This is the first time you're using the interactive metronome and the first time you're doing the long form assessment. The exercises under the task mode, there are 14 of them, and you will need both your button trigger and your tap mat. So now I want you to go over to the view screen, the view tab at the top and choose exercises. And a video pops up that auto plays each of the exercises that you will be doing on the long form assessment. So you will need to pull up the exercises videos, watch the video, read the narrative of how to do it, and then you will perform the task. Now, if you are in a group of 2 or 3, you will alternate people doing these tasks. So not each of you will do the entire long form assessment. You will be taking turns. We just don't have the time for you to do the entire one. And so you'll alternate between you. And to get to the exercises, you just use the toggle bar, just like I'm doing on the right side. and it will show you every one of the exercises that you will be doing for your long form assessment.